Did you know that the top 3 drugs that cause addiction are marijuana, cocaine, and opioids? Welcome back to Nurse Katherine here. In today's video, I will be teaching you about the causes, the pleasure, and the tolerance behind drug addictions, which will hopefully lead you into better understanding your patients who may be addicted to drugs. Before we get started, please give this video a big thumbs up and subscribe to my channel right now, as it will help the YouTube algorithm get this video out to other nursing students or nurses just like yourself. But other than that, let's get this video started. Did you know that the word addiction is derived from the Latin word meaning bound to or enslaved by? I think this clearly resembles what patients with addiction are going through. Just about 23 million Americans, that is 1 in 10 Americans, have an addiction to alcohol or other drugs. Today, addiction is now understood to be a chronic disease. It actually changes the brain structure and function, and the development of a drug addiction is very complex and can have many causes, including genetics, the environment, past experiences, and mental health. Next, let's talk about the pleasure a patient with a drug addiction is experiencing. And all I can say is dopamine, dopamine, dopamine. Dopamine can also be called a chemical messenger and plays a role in how we feel pleasure. Drugs like nicotine to heroin give a person the powerful surge of dopamine. Taking drugs via IV or smoking them rather than taking them orally gives a person a stronger dopamine signal, which then can lead to drug misuse. The nucleus accumbens is flooded with dopamine, which then allows the hippocampus to remember the rapid dopamine surge that we just talked about and the feeling of satisfaction. Repeated exposure to an addictive drug causes those cells in the nucleus accumbens and the prefrontal cortex to communicate. This communication couples the wanting feeling and the liking feeling. This then motivates the person to act on those feelings to find that source of pleasure. And lastly, let's talk about tolerance. I want you to think of your favorite food. Sometimes you just want more and more, but the more you have it, the less desirable it becomes, or it takes eating more of it for you to get that same satisfaction. That is like what happens to your patient who is fighting an addiction. The substance or substances of choice become less desirable. The brain receptors become overwhelmed, which then leads the brain to respond in a way to produce less dopamine or eliminate that dopamine altogether. My hope is that you have learned more about addiction today. Remember to think about these truths when you are taking care of your patients who may be suffering from a drug addiction. This information can help you be a better nurse to those patients. Thank you for tuning into today's video. Make sure you are subscribed and give this video a big thumbs up. But other than that, that is it for today. I will see you all in Saturday's vlog styled video.